In a few short days, almost all states across the nation will, in varying degrees, begin to reopen. What are we going to learn as we begin to take those tentative steps toward a resumption of normalcy? What are the health guardrails that can promote a smart and advanced and resilient economy? My first guest is Vice Admiral Jerome Adams, Surgeon General of the United States. So good to see you, sir. Thank you. So I think it's pretty clear. I mean, my question to you is, what do we need to think about and do as we reopen the economy? What practices do we need to institutionalize to live safely and to also work safely?
Well, great question. And thanks for having me here. I really appreciate it, particularly at this important time in history and in our response to the virus. And we need to make sure we're reopening in a way that is data-driven, that takes into account the assets and the deficits of and challenges that take place in different communities. And I think that's one of the things that's hard for people to really wrap their heads around, is just how big and how different the United States is. What you're going to do in Idaho is going to be very different than what you're going to do in New York. But I tell people, just as we have an epidemic of virus, we also have an epidemic of misinformation. So the most important thing for people to take away is to go to coronavirus.gov, go to whitehouse.gov/opening America, and look at our guardrails, look at our guidelines, because we work hard on the task force to really give people the tools and the information they need to be safe. Now, to get more specific, from my perspective, I try to make things easily digestible. I talk about the two S's and the two C's. The two S's are surveillance and separation, and the two C's are cleaning and coverage. It's important to know from a surveillance perspective what's going on in your community. And we're working with states to make sure they have dashboards that show hospitalizations, that show case counts, that show who's dying and where, so that people understand what the burden is in their communities, because we know humans are more vigilant when the threat level is higher. I wish people were just highly vigilant all the time from a public health perspective, but people are more vigilant when they know there is high rates of disease spread in their communities. Separation, we know the disease travels and lives by going person to person. So the most important thing we can do is maintain 6 feet of physical distance between ourselves and others. From a cleaning point of view, we've got to be better than we've ever been about frequent and thorough hygiene and hand washing, soap and water for 20 seconds. And then from a coverage perspective, if you go out in public, please wear a face covering to protect other people from the virus you might be unknowingly spreading. And please cover your cough or sneeze with a tissue.
You know, earlier this week, I interviewed the director of the CDC, Dr. Robert Redfield, and it's just very clear when you kind of look at the structural deficits in the country on PPE. You know, nobody knew what PPE was before, but, you know, personal protective equipment, on ventilators, on things that were needed, and they had to be created overnight, essentially. It made this town crazy. It made a lot of tension crazy. Another element of this, and we're going to be discussing it shortly in a few minutes, is contact tracing and testing.
Yes.
How confident are you that we're getting all of those elements in place, that we're going to be able to reopen the economy responsibly?
That is a great question. I'll put it another way. Why are we in a better place to reopen and to open things now when we were closing things down just a few weeks to months ago? And what I would tell people is we've learned a lot about this virus in the last several weeks. We've also increased capacity on a federal, on a state, and on a local level. Thank you to America for really doing your part in helping us flatten the curve. Remember, flattening the curve wasn't about saying we're going to get rid of the virus. The virus is going to be here for a while. Flattening the curve wasn't about saying that the virus is not going to be as contagious or as deadly. It was really about making sure we didn't overwhelm our healthcare capacity and that we continue to build up our healthcare capacity to respond. And most places across the country have successfully done that, but we still have to figure out how we live with the virus. And so we know now, again, more about spread, and we can take precautions. The things I mentioned earlier are all things that people are doing more now in terms of cleaning, in terms of coverage, in terms of surveillance, and in terms of separation. We also know that hospitals have better personal protective equipment, have more ventilators, have more capability to be able to respond. And so while we're not saying it is without risk to reopen, we certainly feel like we have more tools available at the local and at the state levels and at the federal level when you look at the national stockpile to be able to respond quickly if we see a resurgence and to not have as high of a peak as we had previously.
Now, I know you're the nation's doctor, and so you try to help people to think differently about their hygiene and come in. And I know early on, you talked about people washing their hands, about touching, about the various kinds of things you talked about, distancing and whatnot, which I think are big issues. Just self-disclosure, I went to high school in Japan, and we learned to bow. We didn't do a lot of handshaking then. They wore masks in Japan. I'm interested in what are those rosters of things that you think we need to stop looking at as boutique, silly things that other people do, that we're all going to have to become much more comfortable with, that we're going to have to begin building in to our social interactions?
Well, everyone asks, when are we going to get back to normal? I think it's important for people to start wrapping their heads around the fact that we aren't going to go back to the way things were. And we really, quite frankly, shouldn't go back to the way things were. There are some silver linings to this, and things that we've learned that will help us move forward in the future. For instance, the things that protect you from COVID-19 also protect you from flu. And people forget that 2 years ago, we had a flu season that killed 80,000 people. And so if we continue to practice good hygiene, that will help us prevent flu deaths in the future, even if we are able to overcome COVID-19. We also know that we saw a big decrease in many communities in vaccine confidence over the past several years, and that really concerns me. If we get a vaccine for COVID-19, it is still not going to help out if we don't get people to embrace it. So I'm hopeful that as more people are talking about vaccinations, that we're going to improve vaccine confidence. Telehealth. We've rapidly expanded access to telehealth services across the nation. And that's something that I hope doesn't go away after COVID-19. And that from a federal perspective, we're looking to try to enshrine in place because it will give people access to coverage in rural communities, but also in places where you've got a single mom and she's taking care of kids and she's working and she just doesn't have time to go to the doctor's office from 9 to 5, even before COVID-19. So she would forego preventive care. Now you have that in place. And even little things like staying in touch with people virtually. There are family and friends that I haven't seen in person in years and who I otherwise wouldn't talk to because culturally we just think you wait until you see them in person. But that said, we've been in touch with them virtually now because COVID-19 has really increased people's utilization of Zoom, of Skype, of FaceTime, of some of these technologies out there that can promote connectedness and togetherness. And that ultimately has an impact on our mental health.
One of the things that haunts me in these discussions, we're now talking to people that probably have computers or devices, they're connected. I'm worried about disconnected communities. I'm worried about vulnerable communities. You have an initiative right now on economic prosperity and community health are kind of aligned with one another, so let's link them and look at it. But I guess I want to ask you, because you're in my view, one of the brave people in the administration to say we have communities out there, many of them are communities of color that are disadvantaged, disconnected. This is hitting them hard. It's hitting, a kind of what I would consider a systemic racism that has distanced them from a lot of this. I guess my question is, what do we all need to hear and think about doing much more, not just talking about it, but realizing that our health is related to their health? And their health is going to affect our health. How do we even that element out? And maybe tell me a little bit about your community health and economic prosperity initiative.
Well, thank you for that. My community health and economic prosperity initiative is all about making the case that we can't be successful as businesses, as communities, economically, if we don't pay attention to poor health. We know that the number 2 expense for most companies out there is healthcare. And we know that the United States has some of the highest healthcare costs in the world, but we aren't getting value on our investment. We still see infant mortality rates, maternal mortality rates, obesity rates, hypertension rates that are well above the average in a bad way, despite spending more per capita on healthcare than anyone else in the world. And so my initiative is really, and it was born before COVID, but was really about helping businesses and communities understand that when you invest in complete streets, when you invest in clean air laws, and when you invest in things that we know give people the opportunity in the environment where they can more easily make healthy choices, that it benefits not just them individually, but it creates a healthier workforce. It makes your town a destination where young people want to move to and raise a family, and ultimately lowers turnover and increases the pool that you have to pull from. And so, critically important that people understand that. And we've seen that come to bear in the midst of COVID in a very tangible and significant way. Unemployment numbers coming out today showing again that when you have a health issue, it ultimately turns into an economic issue. And so I hope as people start to reopen and think about rebuilding and think about resilience, that they think about that interconnectivity and lifting up. Oh, excuse me. I actually have allergies here in the Washington, D.C. area.
Well, we'll take your word for it. We'll take your word for it.
But again, we know that when we don't pay attention to these things, that the vulnerable communities, particularly communities of color, suffer disproportionately, and that's not just COVID-19. That has to do with flu. It has to do with cancer, with diabetes, with heart disease. And my true hope from all this is that as we shine a light on these disparities, we can start to dig into some of these underlying causes of disease and really help people not just survive COVID, but help them survive in the long run from chronic diseases, from non-communicable diseases like high blood pressure, like diabetes, and like cancer. And we're doing that with the White House Opportunity and Recovery Revitalization Council, but we're also doing that at HHS, really promoting hypertension control, promoting maternal health, and I have a call to action on maternal morbidity and mortality, promoting oral health. All these things we know create the environment and the circumstances that either put you at risk for disease or that help you become resilient to disease.
Right now, we have a race to a vaccine, antivirals. I guess we've got about 110, maybe more, clinical trials going on around the world to find a vaccine. One of the issues that's begun to percolate out there is, will that vaccine be able to reach those people who can't afford it, who can't pay for it, who can't cover it? Are you confident that we're going to solve the cost problem and access problem once a vaccine is achieved?
Well, I can only speak for me, but to answer your question, yes. Based on my conversations with the task force and throughout HHS and with the secretary, I personally feel confident we will be able to solve the cost and price problem. This is an issue where, again, people have seen it is far too important. And I've worked for most of my life trying to help people understand why it's important we make the flu vaccine available to people at low or no cost, because if a person gets the flu, it impacts not just them, but their family and their entire community. We see the same thing with COVID-19. We will not be able to reopen even if we have a vaccine, if we don't have vaccine uptake. And so I know there's a commitment on the part of the federal government and on part of the business community to making sure vaccines are available for COVID-19 when they become developed at no cost or at extremely low cost. Now, reimbursement and cost is not the same as access. Access still has to be built on a foundation of trust. And so it's important that we make sure we're bringing in vulnerable communities of color, and involving them in these studies, and also doing outreach to those communities right now to make sure if we do have a vaccine, and even if it is free, that they'll come in and get it, or that they will actually take the vaccine.
Now, let me just ask you a final question. You know, just occurs to me, one of your predecessors, Vivek Murthy, has written a book on loneliness. And I happened to interview the mayor of Miami, Francis Suarez, the other day, who made the chilling comment. They said, you know, we may not be paying a lot of attention to it right now, but COVID is also, you know, leaving a lot of mental health carnage and creating a lot of mental health problems out there, that we may see major spikes in suicides, domestic violence, which we're not hearing about now. And these are also parts of the public health equation. And I'm wondering what you think, what do you want Americans to hear right now on what they can do on that mental health front at a point where we're all sort of forced to be isolated, and you kind of have, you know, as Vivek said, a loneliness almost as a result?
Well, thank you for that. And again, just as I've been working on my community health and economic prosperity initiative long before COVID-19, Dr. Murthy, one of my friends, has been working on his loneliness initiative long before COVID-19. These problems existed well before the virus came to our doorsteps. They've just been really amplified because of the virus. And what I say to people is that social distancing and physical distancing does not have to mean social disengagement. Again, there's new technologies, new opportunities for people to communicate in ways they never have before. There's really a focus on mental health and a destigmatization of mental health. I'm actually working with the National Basketball Association, with the NBA, and with the Prevents Task Force on Veteran Suicide Prevention to really help people who have traditionally held a lot of stigma in regards to mental health. When you talk about athletes, when you talk about people in the military, and to really help them understand that mental health is just as important and should be held in just as high of a regard as your physical health. And we're really seeing that start to gain some traction now with COVID. One of the things I'd say to people is, if you find yourself struggling or just want someone to talk to, remember, you're not alone. There is a helpline called 1-800-273-TALK, 1-800-273-8255 for free and support.
Well, with that, I want to thank Surgeon General Jerome Adams for anchoring our discussion on health guardrails. Thanks very much. I hope we can have a conversation with this and down the road where we will have achieved a lot and we're in a very different place. So thanks very much for joining us today.
Thank you. And parents, get your kids vaccinated. Critically important. We know that vaccination rates and in recent MMWR are trending down, but it's important to reach out to your physician. The American Academy of Pediatrics launched yesterday a new Call Your Pediatrician campaign. This time last year, we were fighting outbreaks of measles, and we're set up for them again after COVID-19. We want to make sure we're protecting our most vulnerable, and particularly from diseases for which there is a vaccine. Measles, whooping cough. Please talk to your provider, make an appointment, figure out how to get your child vaccinated today.
Thank you so much for that important message. Look forward to talking to you again.
Thank you.